We face a range of challenges. We're still working on a block contract arrangement, so therefore the flexibilities to tweak the portfolio within a given amount of money is limited, and that will change over the next year and a half. So the second element is we still have to achieve foundation trust status along with all of our NHS trusts, and obviously coming to the party late as an NHS trust means we've got to get there quicker and much quicker than everybody else has done up to now. Our timeline is hopefully authorisation as a foundation trust in April, May 2012. And I think the third element is the Ellen Willing provider model will put a lot more contestability primarily into our sector, first of all, and therefore we have to be reactive to those changes and almost make ourselves marketable and ready for patient choice, whereas in the past we haven't had to do that. And of course that will be a major challenge for any organisation to do all those things at the same time.
Absolutely. And the first one, the speed of which you're having to work. It's been one of the issues about the bill that it's too much too soon. How do you respond to that in terms of what you've had to do so quickly?
I'm comfortable with it as a provider. I have to say some of the bill really puts in a focus and some absolutes which were perhaps missing in the system before, and I think as a consequence the apparatus of decision making, bureaucracy, legislative framework will catch up and mean that we can do the things quicker. So the speed doesn't really worry me. I suppose the only concern would be is ensuring that some of the systems architecture that the primary care trusts perhaps do hold in their power at the moment cannot be left drift and fall out, because that will affect other providers and ultimately will affect patients, and we must get those things right in the transition.
And what opportunities are there for you in this new trust?
As a community trust, we believe that there are a range of things we should be able to do better, more efficiently and quicker, and for better patient satisfaction. So there's always been a historical bias that so much is provided on acute campuses. They're always provided on tariff. We believe a range of those things don't need an acute campus to support them. They should be done in community facilities, and a range of those things should be done in people's own homes. So we think that's expertise that we bring and we should develop. I think the second element is the ability to link community staff with primary care staff to manage local population needs and therefore avoid the need for so much acute usage and probably so much emergency admission work. We think that's going to be a major benefit of us developing how we undertake our affairs. And I think the third element is, as we are doing at the moment, is we will probably be able to offer our expertise across a wider geographical area than we do currently. At the moment we're county bounded. In April we'll be undertaking work in Suffolk, Peterborough, Luton. I think if we can ensure that our services are delivered locally, are responsive and are what commissioners want to buy, there's no reason why that couldn't be afforded across a wider geographical area.
At the same time, you're dealing with other providers. How does that affect you?
I think there's been a better sense of collaboration in a non-cartel way, I should say, talking to Mills and Reeve, of course. But that will mean that we have to understand the impact of how we structure our businesses on each other. So we do now have acute trust, community stuff, primary care, mental health trust sitting down and saying, actually, I'm planning to do this, what is the impact going to be on you? And we've got social care around the table in those discussions. We provide older people's social care work on behalf of the county council, so it's kind of important for us that we know how that whole patient flow impact is going to make a difference to us as an organisation. And that is starting, and it's good. It's much better than it ever used to be.